The first experience that I have with the healthcare system that I remember is the doctor crying as she gave my mom the diagnosis of a long, scary word that I didn't understand. My mom was visibly upset, and I heard the words life-threatening. I didn't realize at this moment how horrible the rest couple of months was going to be. I remember sitting there thinking that I had no idea what was going on, and I really didn't understand that the next couple of weeks and next couple of years and the next couple of 10 years to where I am now was going to end up so startling and so confusing. Before this moment, my only experience with the healthcare system had really been for small, unrelated things. I had broken a couple of bones and had a couple of casts put on. I got strep throat a few times and was prescribed antibiotics. I was getting a lot of headaches and stomach aches, but none of this really seemed to be very related. I was a competitive gymnast at the time, and I began losing all of my tumbling skills, and it got to the point where I couldn't even stand up off the floor on my own or walk up the stairs. I ended up taking a lot of naps, which was really odd behavior for me at the time. And even at this young age, I knew that there was something seriously wrong, but I really couldn't put it into words to help my mom understand. A rash on my elbows, knuckles, ankles, and knees is what led me to the day that I was diagnosed. My pediatrician sent me to a dermatologist that did 2 biopsies on one on my elbow and one on my knee. At the time, I thought that this was some pretty serious stuff, but little did I know that the worst was yet to come. A week later, I was sitting in the room as the doctor tearfully delivered the news that I had a rare, life-threatening autoimmune disease called juvenile dermatomyositis. Because of my disease, I take 21 pills a day, get admitted to the hospital once a month for 2 infusions, and I see 12 different doctors across 4 different states. At the time, as an 11-year-old, this was all so overwhelming. The doctors talked to my mom instead of me. They asked me a million questions that I didn't want to answer, and worse, they asked them over and over again. We had to wait a lot, not just a couple of minutes here and there, but we had to wait for hours and hours. Imagine waiting in a room as an 11-year-old when you are terrified of what the doctor might say to you, you don't want to be there, and you really don't feel well. I started having to get a home health nurse that would come to my house once a week to give me an infusion. She would routinely have to stick me 4 to 5 times to get the IV started. And on top of all of this, I started taking medications that made me gain weight. I went from 65 pounds to 99 pounds in the matter of a couple of months. When I left 6th grade, I looked like this. And when I showed back up for my first day of 7th grade, I looked like this. I hate looking at these pictures still to this day because it reminds me of every horrible traumatic memory that I have associated with this period of my life. However, I do share these in the hopes that it will help the next scared 11-year-old girl be able to better handle her new life as a patient. And don't get me wrong, I am very thankful for all of the care that I've received from my doctors and nurses, but I do believe that it could have been delivered in a way that comforted me rather than causing me unnecessary anxiety and frustration. As an 11-year-old, I was told that a good patient does what the doctor says, is patient, doesn't complain, tries to explain everything exactly perfectly as to how you were feeling, and most importantly, you don't question the doctor or the system at all. And I think that today, the average patient is told that this is what a good, compliant patient is. So by the time I was 15, I was finally sick and tired of how I had been being treated for the past few years. I was admitted to the hospital at one point. I had aseptic meningitis as a side effect of one of my treatments. And I ended up, at this point, after 4 days of being in the hospital, I was exhausted, I was tired, I was so over every experience that I had had at that moment, that I started ranting to my mom. She ended up videoing it, and we made a YouTube video where I basically just shared all of my frustrations that I had as a patient. It ended up going a little bit viral around the healthcare community, and I began receiving emails from patients all across the world of them sharing the same frustrations that I did. I never really realized until that moment how horribly and how insanely frustrating the system is, and how many people actually realize that and experience the same things as well. So from that day forward, I began telling my doctors exactly how I wanted to be treated. And over the past couple of years, I have learned that I think that we all have a part to play in making the patient experience better. So today, I'm here to tell you, doctors and nurses, you have a choice. Patients, you have a voice. Friends, families, you are an integral part. And to the wider healthcare community, it takes a village. Doctors and nurses, you have a choice in how you treat patients. Just because it is how you were trained, or if you are frustrated with your day at work or how exhausted you are, you have a choice in how you treat your patients and how they walk out of the hospital or the appointment, how they walk out feeling. Try to respect a patient's time. One of the most frustrating parts of the healthcare system is having to wait for hours and hours and hours because nobody seems to know what a clock is. But I recently went to a new primary care physician, and they basically ended up scheduling me for the exact amount of time that I asked for and needed. And so my appointments started exactly on time and ended exactly on time. And I was shocked by this. I had no idea that this way of doing things was even possible. And I do look forward to the day, or at least I hope, that day comes at one point where every doctor's appointment will be able to be like that. Often healthcare can feel very impersonal. I really always appreciate it when my doctors ask me about my life outside of healthcare, because not only am I a patient, but I am also a 21-year-old college student with hobbies, friends, and a lifestyle outside of what you see of me in the 15 minutes that you get to spend with me in the room. By asking patients what their lifestyle is, it can really help create a treatment plan that works for everyone involved. Because patients are much more likely to stick to a treatment plan that is tailored around their lifestyle and their schedule already. For example, when I was going to college, my doctor knew that he needed to take me off of one of my medications because he already knew about my lifestyle outside of his office. He knew that I would really like to have the freedom to not have to give myself an injection every day. And nurses, it doesn't have to be a huge solution, but little things can really make a difference. Like I mentioned before, when I was in the hospital with aseptic meningitis, I had a really bad light-sensitive headache. And I told my nurse this, and she came up with a very, very simple solution of just putting a blanket over the IV monitor. That was such a simple, easy solution to do, but the way that she took the time out of her day just to think about that for a little bit, it really showed me that she cared. Typically, the way of judging how well a patient is doing and their well-being is done through lab results or silly questions that are difficult to answer, such as, how is your overall well-being? I mean, I don't really know how am I supposed to answer that. I have 3 autoimmune diseases, and I can be doing good at certain points and not so much. It's really hard to put a single number on that, like the pain scale question. When they ask you, what is your pain from 1 to 10? Well, I mean, a 5 today could be a 2 tomorrow, and then that 2 could be a 10 another day, all depending on what else I have going on in my life and what else is happening with my body. It is all relative. So I started telling my doctors that I'd rather that my well-being be decided based off of if I can do the things that I actually enjoy doing. Because if I can't go hang out with my friends or make it to class or go ride my horse, then in my mind, I'm really not doing well at all. A lot of people seem to think that healthcare needs a huge overhaul, which I'm not saying that it doesn't, but there are also a lot of small, simple, just human kindness touches that can really make or break the patient experience. Doctors, you have a choice, so use it wisely. I like to say that doctors go to medical school to become doctors, but patients don't get to go to a patient school. Help them learn how to help you. By all of us working together, we can make it a better experience for not only the patients, but also for the frustrated doctors and nurses and the frustrated hospital administrators, and many, many others. Patients, you have a voice. You are allowed to speak up and demand your preferences. A lot of doctors may think that some of your preferences are silly or seem unreasonable just because it isn't what they would want if they were in your situation. But you have to stick up for yourself and make sure that you are heard. Doctors and nurses are trained and educated on test results and symptoms, but they have never lived a day with your disease. You have. And over the course of having a chronic illness for years, you tend to pick up what works best for you and what works best for your disease. I always tend to ask my nurses to draw my labs separately from my IV stick, which seems really weird because a lot of people are like, why would you rather get stuck twice? When in reality, I really it always ends up being more inconvenient for me because whenever they do it through the IV stick, they end up having to wiggle the IV around, it ends up hurting more, digging around. And then for some weird reason, it also always seems to end up clotting. So I end up having to get stuck twice anyways because since the blood sample clotted, they have to come back in at 4:30 in the morning and stick me again. So I have learned over the years that even if it doesn't really make any sense to other people, if you have found something that works for you, you should speak up and share your preferences. Another example I have is When I moved to college, I had to switch hospitals, obviously. I went to a college 7 hours away from where I lived. I ended up at my old hospital for my IVIG infusion. They put all of the medicine comes in 10 bottles. The medication is just very frothy in general and very bubbly. And so at my old hospital, it was always very inconvenient and very annoying and very frustrating for everyone involved because my nurses would have to come in and change the bottles every hour, and then on top of that, since the medication is so frothy, all of the bubbles would get stuck in the line, and the IV would constantly be beeping, which honestly, the beeping from the IV still haunts my dreams sometimes. At my new hospital, they came up with a really simple, logical solution. They dumped all of the 10 bottles into one bag, which gave the medication a longer time for the bubbles to settle, which meant that I got to actually sleep during the night, and my nurses got to not have to be running in and out of the room all the time. Don't be afraid to ask for what you want. You're allowed to find patient groups and see what has worked best for others in the past. Get a second opinion for big decisions, and definitely do not be afraid to speak up. To friends, families, and the wider healthcare community, we as patients need your support. Even if you don't already, which I'm sure most people have, but at some point you will have a relative, friend, parent, child that it will have some sort of large health issue that they will want your support for. And to the wider healthcare community, hospital administrators, legislators, patient groups, there is a place for everyone in making the experience better. Last September, when I thought I had kind of figured the whole healthcare system out, life decided to throw another curveball at me, and I ended up being in a really bad car accident, and I ended up facing really severe memory issues from that. And so, whereas before I was a very self-dependent, I kind of was a very strong patient advocate for myself. I knew what I wanted, and I knew how to express my needs. It got to the point I was losing all of my memory to where I couldn't do that for myself anymore. And so I really needed all of my friends and family to rally around me during this time to help me refigure out the healthcare system. I have also found that a lot of people don't really understand, or they're cautious and hesitant as to when someone gets sick. They don't really know what to say or what to do. But as patients, it is often difficult to express what you need. You always feel like you're a burden, or you may feel like you're asking for too much. As friends and families, you should be specific when offering help. Don't just say, hey, is there anything I can do for you? Actually give specific things like, hey, would you like me to bring dinner over for you? Would you like me to come over and just keep you company and watch a movie or something? But obviously, don't be offended if they say no, because you have to think they're probably not feeling well as well. Another thing is I really hate overly optimistic comments like, oh, but you look great. Like, yes, I may look great, but I am spending a lot of time and effort into making myself look as normal as possible. So it can come across as condescending sometimes. It almost seems like people are belittling your problems, because just because I look well doesn't mean that I'm not in pain, I'm not suffering, and I don't need help. And will someone please, dear God, help bring the healthcare system into the 21st century? I'm 21 years old, and before I got diagnosed, I had no idea what a fax machine was, but that's healthcare's favorite tool, apparently. So you have to know your audience. Most people my age, especially my age, it is just so much more convenient to have all of your information on one device, on your phone, digitally, where you can bring it wherever you want, pull it up wherever you want. And for some reason, it always seems like healthcare is 20 years behind. Another thing is, if you have a patient portal, please make sure it actually works, because I now have, I think, 23 and counting patient portals, with different usernames, passwords, site addresses that I'm all expected to remember. And on top of that, there's a lot of information in those that isn't actually correct. A lot of them say no diagnoses or no medications, which while I wish was true, it unfortunately is not. So it's not really reliable, and it's not convenient for anyone involved. Technology has advanced, and the healthcare system and patients should demand better. So as you can see, I have had a lot of rough experiences with healthcare. But I have found over the years that there are a lot of simple solutions that aren't too difficult for everyone to implement. It doesn't necessarily require a huge overhaul in the entire healthcare system, because a lot of healthcare is really about those small kindnesses. So doctors and nurses, I beg you, when you are doing your job, think of me and all of the other patients like me, and try to make their experience just a little bit better. Even if you are frustrated or exhausted, or tired or anything, I promise you patients are also exhausted. Try to ask for their preferences, or try to find ways where you can make their lives just a little bit easier. And patients, You have a voice, use it. You have the right to become your own advocate. You have to become your own advocate. That's what it's come to at this point. And you have to speak up for yourself, get engaged, do your own research, find second opinions, find patient groups, and friends and families in the wider community. A lot of times, patients can feel really helpless and very hopeless, lost, and lonely. And all we really need is someone to stand with us and fight along with us. Without patients' voices and without clinicians' powerful choices, we know what the outcome will be, because systems persist, and so must we. I know we can do better. We have to listen to the patient in need. Please, let's solve this together.